Hey everyone, I want to chat with you about thyroid function and some really new cool research on optimizing thyroid function and seeing how it significantly improves pregnancy rates for patients that are dealing with infertility. And before I jump into that, I would like to mention that when I work with patients that have unexplained infertility, um, the mindset that I think a lot of us come into the fertility treatment with is, well, there's nothing wrong, therefore it should work. But when you have an obvious problem like unexplained infertility, where you've been trying in many cases for couples years, and you're not getting pregnant, and then you do like the basic testing, and it comes back, everything's normal, then the issue isn't that there is no reason for the infertility. It's usually because you're running the wrong tests. And what I mean by that is, if you're checking for um, a a problem and why a health condition is occurring or why you're not reaching this health goal, and you do a bunch of tests and if it says that everything's fine and it should work, but obviously it's not fine, it's not working, it means we need to do a bit more digging and looking at other tests that might give us the information we need on what might be actually delaying time to conception. And so thyroid is one of those fascinating fields where what's considered normal for fertility is kind of a moving target. And the studies aren't really consistent in their recommendations either. So some studies recommend, treating thyroid when it's in a certain range. Others argue that it should be treated in a much lower range. So I'm going to chat with you about that in a bit more detail. So first off, the most common thyroid test that's done is called TSH, and that's called thyroid stimulating hormone. And that is a hormone produced from the pituitary gland, and it travels through the blood to the thyroid gland, and it works as a signal to increase thyroid hormone production. So T3 and T4 from the thyroid gland, which then travel to other organs to exert their beneficial impact. And in fertility, thyroid hormone is absolutely necessary to support ovulation, cycle regularity, implantation, and supporting pregnancy. It improves and supports estrogen and progesterone production. So we see a large impact from such a small gland on the systemic um, functioning and optimal health, and that includes healthy reproductive function. So if we start to see a decline in thyroid hormones as TSH starts to go up. And so the American Thyroid Association actually recommends patients that are trying to conceive should be treating their thyroid or be receiving thyroid hormone if their TSH is above 2.5. And there are some studies that say that it should be actually a bit higher. We don't need to treat if it's 2.5, probably closer to 4. And then this is where we run into a separate issue is when there is the presence of thyroid autoimmune thyroid antibody, so anti-thyroglobulin antibody or anti-thyroid peroxidase antibody. If we have a patient that has elevated thyroid antibodies, that range of where we should be treating the thyroid starts to come lower, and we should be treating it at an earlier stage in many cases. And the reason for that is pregnancy and fertility treatments significantly increase estrogen levels, and estrogen will slow the thyroid function down. So it's well known that once a patient goes through a fertility treatment like IVF or IUI, that TSH will actually jump up in many cases, and it's expected to go up in pregnancy as well. And each trimester, we anticipate that TSH usually goes up by zero point 0.5 on the lab test per trimester. So first trimester 0.5, then another 0.5, then another 0.5. So we want to basically in the prenatal period when we're right about to conceive or trying to conceive, make sure it's at a healthy level to basically address that. The TSH is going to be climbing up, and we want to make sure the thyroid is in healthy range right from the get-go, because if the TSH is too high, the miscarriage rates tend to be a lot higher as can make conception a lot more difficult because it impacts potentially implantation. So this new research paper was published in the last year, and basically they looked at a group of patients that had subclinical thyroidism, so the TSH was above 2.5, but they didn't have any symptoms, and then patients who had full-blown hypothyroid, so the TSH was above 4.5 and they had hypothyroid symptoms. And on average, these groups of patients, they had been trying to conceive for almost 6 years, some less, some more, but that was the average. And so this study looked at, if we treated the thyroid and just brought that TSH to below 2.5, how many of these patients end up conceiving. And within 6 months of initiating thyroid hormone therapy, 54% of those patients were able to conceive. So this is pretty significant, especially when we consider patients who have like a suboptimal thyroid. So if the TSH is 3, 3.5, 4, but it's not really in the hypothyroid range, is it really helping or is it decreasing the likelihood of getting pregnant naturally? So this is something we need to assess, and sometimes that involves doing a little bit of extra testing where we'll check for free T3 hormone, free T4, and these thyroid antibodies that I had mentioned earlier. So it's one of those things that we will screen for, especially in patients that have a family history of thyroid disease, because the likelihood of developing a thyroid disorder, of having a thyroid disorder, is almost like 6 times higher or something like that, about 6 times higher in the patient if they have an immediate family member that also had a thyroid issue in their medical history. So this is something that we need to look a little bit closer at for many patients, especially for patients that have unexplained infertility, because a lot of them come back, well, the TSH is normal, but then we'll run the test and the thyroid antibodies are incredibly high, and that TSH range is no longer optimal for someone trying to conceive with an autoimmune thyroid condition like that. And same with even in the absence of thyroid autoimmunity, sometimes patients have this TSH that's just a little bit over where it should be, and bringing it down with a little bit of thyroid hormone may be beneficial in those cases. So this is something that needs to be evaluated, obviously, case by case, pros and cons, what are the benefits and risks for each patient. Is there a risk of severe harm? Is it pretty safe for this patient based on other medications they're taking, based on their medical history, and evaluating and having that conversation with the patient so they can be part of that conversation and be able to make an educated decision on whether that this is something that they would like to try and what the pros and the benefits and risks are of the thyroid therapy, thyroid hormone therapy. So, with unexplained infertility, it's never really one thing that's causing the issue. I find for a lot of patients, it's a combination of multiple issues, and the thyroid is something that can play a factor for a lot of couples experiencing unexplained infertility. Anyways, if you guys have any questions whatsoever, check out our blog post for this week. It has a more detailed description of the research and how to evaluate for thyroid function. And if you have any questions, drop us a message here on Instagram or send us a direct message. And as always, we're happy to respond. All right, take care, everyone.